My name is Watisha Buckles. Today is January 21st, 2025. This is spring 2025. I'm scanning the room, the floor, the ceiling. I'm inspecting the skin on the head, face, neck, anterior chest, posterior chest, and abdomen for color, temperature, moisture, texture, edema, turgor, for bruises, scars, lesions, and nevi. I am inspecting the head for size, symmetry, and midline position. Head is normocephalic and midline. I am inspecting and palpating the hair and skin on the head and scalp. Hair is dark brown. Texture is soft. Hair is evenly distributed. Also inspecting and palpating for lesions, masses, tenderness, depressions, and infestations. I'm also palpating the temporal arteries. Next, I'm palpating the lymph nodes, preauricular, postauricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and subclavicular. I am next assessing for TMJ. I'm palpating. Open your mouth, move your jaw side to side. There's no subluxation, no crepitus, and no tenderness. Next, I'm assessing cranial nerve 5, which is it's the trigeminal nerve for motor and sensory. For motor, palpate. Clench your jaws. I'm palpating his jaws while he clenches his maxillary. All right. You can relax. Close your eyes. Tell me where I'm touching.
Forehead, nose, left cheek, chin.
All right. Open your eyes. Cranial nerve 5 is intact. Now I'm assessing cranial nerve 7, which is the facial nerve, by having him to smile, frown, puff out your cheeks, raise your brows, and pucker your lips. All right. Cranial nerve 7 is intact. Now I am inspecting the ears for shape and position. Ears are symmetric and evenly positioned. I am palpating the pinnae and the tragus for masses and tenderness. Next, I am inspecting his auditory canal and tympanic membrane. On the right, auditory canal patent, tympanic membrane pearly gray with positive light reflex at 5 o'clock. On the left, auditory canal patent, tympanic membrane pearly gray with positive light reflex at 7 o'clock. Next, I am assessing cranial nerve 8, which is the auditory vestibular nerve, with the whisper test, the Weber test for lateralization, and the Rene test for air conduction and bone conduction. Cover your right ear. Repeat what I whispered.
1, 2, 3.
Now cover your left ear.
1, 2, 3.
Okay, and now the Weber test for lateralization. Tell me if you can hear the vibration more on the left, right, or in the middle.
Middle.
Okay. Now the Rene test. Can you hear it?
Yes.
Can you hear it?
Yes.
Okay. Can you hear it?
Yes.
Can you hear it?
Yes.
All right. Cranial nerve 8 is intact. Now I am inspecting the brows, the lashes, and palpebral fissures. I'm inspecting the sclera and the conjunctiva, sclera white, conjunctiva pink. No discharges, no lesions. I'm assessing cranial nerve 2, which is the optic nerve for gross visual acuity and central peripheral vision. Cover your right eye and read the smallest line you can see.
LTFPH.
Now on the left.
LTFPH.
Now read with both eyes.
LTFPH.
Vision is 20/20. Let me know when you can see my hands.
I can see it.
Cranial nerve 2 is intact. Now I'm assessing cranial nerve 3, which is the oculomotor nerve for pupillary response. Open both your eyes really big for me. Pupils are equally round and reactive to light with a gauge of 4. Now I'm going to assess for accommodation and convergence. Look up there. Follow my finger in. Good. Now I'm going to assess cranial nerve 3, the oculomotor nerve, cranial nerve 4, the truncular nerve, and cranial nerve 6, the abducens nerve, using the 6 points on the visual field for extraocular movement. Cranial nerves 3, 4, and 6 are intact. Now I am going to assess for red light reflex on the right. Margins are sharp, no AV nicking, no woolly bodies. On the left, margins are sharp, no AV nicking, no woolly bodies. Inspecting the nose, it is midline and straight. Now I'm assessing cranial nerve 1, the olfactory nerve. And also nasal patency. Close your eyes. Close your right, the right side of your nose. Hold down the right side of your nose. Can you smell this? Okay.
Yes.
Okay, now the left. Can you smell this?
Yes.
Okay. Cranial nerve 1 is intact and bilateral nerves are patent. I am palpating his frontal and maxillary sinuses. Now I'm inspecting his mouth and throat, beginning with his lips, teeth, gums, buccal mucosa, open your mouth, his tongue, his palate, raise your tongue, the floor of the mouth, and his salivary ducts. Lick your tongue out. I'm assessing his posterior pharynx and his tonsils. And now I'm assessing cranial nerve 9, which is the glossopharyngeal nerve, and cranial nerve 10, the vagus. Say ah. His uvula and soft palate rise symmetrically with phonation, so cranial nerves 9 and 10 are intact. Now I'm assessing cranial nerve 12, which is the hypoglossal nerve. Lick your tongue out, up and down, side to side. His tongue is midline without fasciculations, so cranial nerve 12 is intact. Now I'm assessing his posterior chest. Turn around for me. I'm looking for signs and symptoms of respiratory distress. That's use of accessory muscles, nasal flare, and tripod position. Retractions, tachypnea, and cyanosis. I am also inspecting his chest for any obvious signs, symptoms of deformity. Next, I am palpating for symmetrical chest expansion. And now tactile primitus, say 99.
99, 99, 99, 99.
Next, I am going to percuss his lung field. Now I'm going to auscultate his lung field, starting above the scapula and working my way down to his basis and lateral lung areas. Breathe in and out. There you go. Next, I'm going to auscultate for bronchophony, then egophony, and then whisper pictoriloquy. Bronchophony, say 99.
99, 99, 99, 99, 99, 99, 99, 99.
Now egophony, say the letter E.
E, 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 E.
And next, whisper pictoriloquy. Whisper 1, 2, 3. Okay, you can turn around now. Now I am inspecting his interior chest for any obvious signs of deformity and for symmetry. Now I am going to palpate for symmetrical chest expansion. And now tactile primitus, C99.
99, 99, 99.
And now I'm going to auscultate his anterior long fields. 3. I'm also going to inspect his neck. I am palpating his trachea, it is midline. I'm palpating his thyroid. Push to the left, swallow. Push to the right, swallow. Palpating his carotid arteries. And I'm going to auscultate his carotid arteries. For bruise. Now I'm going to auscultate the 5 cardiac points using first my bell and then my diaphragm. The aorta, pulmonic, Erb's point, tricuspid, and mitral. And now with my diaphragm, aorta, pulmonic, Erb's point, tricuspid, mitral, and I'm palpating for the PMI. And I will auscultate for a minute, and it is regular, and the rate is 68. Now I'm going to have him to lie back at a 30 to 45 degree angle. I'm assessing for jugular vein distension, and I'm looking for heave. There are no heaves, no lifts. I'm going to auscultate the 5 cardiac points for thrills. First with my bell, aorta, pulmonic, Erb's point, tricuspid, and mitral. Now with my diaphragm, aorta, pulmonic, Erb's point, tricuspid, and mitral. Now I'm going to have him to lie supine, and I'm going to again auscultate with my bell, aorta, pulmonic, Erb's point, tricuspid, and mitral. And now with my bell, aorta, pulmonic, Erb's point, tricuspid, and mitral. Now inspecting the abdomen for for contour and symmetry. I am auscultating the aorta, the renal arteries, the iliac arteries, and the femoral arteries. I am auscultating the 4 abdominal quadrants for bowel sounds: right lower, right upper, left lower. I am percussing the four abdominal quads for tympani, dullness, and flatness, right lower, right upper, left lower. Now I am palpating the four abdominal quads for masses and tenderness. That's right lower, right upper, left lower. Now I'm going to palpate his spleen. Take a deep breath in, let it out. I could not feel his spleen. That's normal. Now I'm palpating for his liver. Take a deep breath and let it out. I could palpate his liver. That's normal. Okay, sit up and face the back wall for me. Now I'm assessing for CDA tenderness. Okay, you can turn around now. Now I am assessing the joints of his hands, his wrists, elbows, and shoulders for redness, tenderness, swelling, nodules, deformities, crepitus, and symmetry. I am palpating his capillary refills and palpating his his radial arteries. And next, I am assessing the range of motion of his fingers. We're going to repeat after me. We're going to flex, extend, hyperextend, abduct, adduct, thumb opposition. And now the wrist, we're going to flex, extend, hyperextend, radial deviation, ulnar deviation, and rotation. And with the elbows, we're going to flex, extend, hyperextend. The shoulders, we're going to flex, extend, hyperextend, abduction, adduction, internal rotation, external rotation, and circumduction. Now I'm going to assess the grips of his hands. Squeeze my hands as tight as you can. Grips are 5 out of 5 strength. Now the biceps and triceps with the elbows flex and extended. So pull in, now push out. And now the shoulders, pull in, push out. Elbows and shoulders, 5 out of 5 strength. I'm assessing cranial nerve 11, which is the spinal accessory nerves. Push up against my hands with your shoulders. Cranial nerve 11 is intact. Now I'm assessing cerebellar coordination, rapid hand movements, flip-flop, rapid serial finger movements. And now touch your nose and touch my finger 3 times. Okay, now I'm going to assess stereognosis and graphesthesia. Close your eyes. Hold out your hands, palms up, please. Okay. Tell me what number I'm writing in your hand.
2.
And what letter is this?
O.
Okay. And what object is this?
Penny.
And what object is this?
Key.
Okay. You can open your eyes. Also, assessing the bilateral upper extremities and bilateral lower extremities for color, warmth, skin integrity, and also for edema. Next, I am assessing bilateral upper and bilateral lower extremities for sensation. Close your eyes. Tell me if this is soft or sharp.
Sharp. Soft. Sharp. Soft.
Okay, you can open your eyes. Now I'm assessing vibratory sensation First in the ulnar prominence. Can you feel it?
Yes.
Can you feel it?
Yes.
And now the medial malleolus. Can you feel it?
Yes.
Can you feel it?
Yes.
Okay. I am now assessing his deep tendon reflexes, starting with the brachioradialis, the biceps, the triceps, patella, Achilles, and Babinski's. Next, I am inspecting his toes, his ankles, his knees, and his hips for redness, swelling, tenderness, nodules, crepitus, deformities, and symmetry. I am palpating the toes. I'm palpating the dorsalis pedal pulses. I'm palpating the posterior tibial pulses. Now I am assessing range of motion on the toes. Do what I do. We're going to flex, extend, hyperextend, abduction, and adduction. Now the ankles, we're going to dorsiflex, plantar flex, inversion, eversion, and rotation. And next, I am going to assess his strength in the ankles. Dorsiflexion, push up against my hands. Good. I push down. That's 5 out of 5. The knees, push up. Good. Pull in. Knee strength, 5 out of 5 with flexion and extension. And now the hips, push in and push out. And it's 5 out of 5 with abduction and adduction. Now I'm going to have him to stand. Stand for me. And we are going to, I'm going to assess I'm assessing range of motion of the hips. On the right, we're going to flex, extend, hyperextend, abduction, adduction, internal rotation, external rotation, and circumduction. On the left, we're going to flex, extend, hyperextend, abduction, adduction, internal rotation, external rotation, circumduction. And now I'm going to have him to bend over. And I'm palpating, inspecting the spine for curvatures, alignment, scoliosis, tenderness, any deformities. I have him in a flex position for his lumbar spine, straighten up. That is extension, lean back. That is hyperextension. And now lateral flexion and rotation. And now the cervical spine, we're going to flex, extend, hyperextend, lateral flexion, and rotation. Now I'm going to have him to close his eyes. For 30 seconds, I will watch him, and there's no swaying, no movement from side to side or anything. Now open your eyes. Walk towards the camera in a straight line. Now turn around and walk back to me. Regular gait in tandem. Now I hop up and down on one foot at a time. And that completes my assessment.